There's been a change in the way that we test these cells that we take from the embryo, and that change has been recent, over the last 4 to 5 years. There's an older technology called FISH, and basically that only allowed us to look at about a third to a quarter of the genetic complement of the baby. And now we're able to look at the entire complement. And every year we're devising new diagnostic tools that lets us look at it in more detail, greater accuracy. So this technology is just, as everything in medicine and technology seems to do, just moving light years every time you turn around. So humans have 23 pairs of chromosomes. And aneuploidy, which is the fancy word for when this doesn't work well, is when you have an extra copy of one of those chromosomes or a negative copy, a minus copy of one of those chromosomes. Comprehensive chromosomal screening is simply a term that means that we're looking at all of the chromosomes, and that hasn't always been true. Up until about 4 or 5 years ago, we would only look at maybe a third of them. And because errors we think are pretty well distributed around all 23 chromosome pairs, intuitively it makes sense that that didn't give us the results that we wanted. Pre-implantation genetic diagnosis, or PGD, is a term used when we are looking for a specific trait that we know exists in either parent. And so, for example, if both parents had cystic fibrosis carrier trait, so they don't have cystic fibrosis, but they did a test that lets them know that they harbor this as a recessive trait. And if both partners have that, then there's a chance that the child could be affected. What we're able to do now is actually test for that specific mutation and be able to tell those parents, no, this child is not affected with this, and we feel more comfortable moving forward. A lot of times we'll do what's called pre-implantation genetic screening along with it, which is what we talked about earlier, PGS. That's where we're looking for all of the 23 chromosome pairs, so we can increase efficiency and safety at the same time. There's been cases that we've done that have just been incredibly difficult. Lethal conditions for the baby where couples have had a previous child that they've lost. And thankfully now we're doing more preconception carrier screening to be able to get out in front of that, so we're not dealing with couples that have already gone through a tragedy. So I think that the future just holds just really exciting and wonderful things in this regard.